everyone, and welcome. You are listening to My Menopause Radio, and I'm your host, Dr. Mache Seibel, and I'm also the founder of My Menopause Magazine, which you can find in the Apple newsstand, and it's getting fantastic reviews, and I hope you will check it out. Now, one of the big problems, it's an embarrassing problem, it's a problem that nobody likes to talk about, but it's one that affects an awful lot of women, and that has to do with problems with the bladder, trouble controlling their urine flow. And we're going to address that today and give you some information that's going to be immensely helpful to you if you are facing this problem or if you have a family member or friend who does. And to help us do that, we're going to be talking to a colleague of mine and a friend and someone who is incredibly knowledgeable about it. His name is Dr. Abe Morse, and he's an assistant professor of OBGYN and reproductive biology at Harvard Medical School, and he's also an attending in the Division of Urogynecology at the Brigham and Women's Hospital. So thank you so much for joining me today.
My pleasure.
You know, this problem of incontinence is really something that, to me, problems of urine, it's not just incontinence, but problems of urinary tract problems is a big issue for women. I mean, and it's one they don't like to talk about. I mean, I understand that the average woman will wait 5 to 7 years to even say she has a problem. Is that right?
We certainly see plenty of folks who wait that long and sometimes even longer. Luckily, I think with the help of the American Urogynecologic Society, we have improved a little bit the overall recognition that these are common problems and these are treatable problems. So thankfully, sometimes we see folks who don't wait that long, either because they find us on their own or because their doctors find us.
You raised a big word there, urogynecology, a urogynecologist. So what is a urogynecologist? Is that a regular gynecologist, or what is that?
So urogynecology is one of the newest medical specialties, and a urogynecologist can come either from a urology background or an OBGYN background, and they participate in a 3-year fellowship in intensive training in evaluation and treatment of problems of the bladder and of pelvic organ prolapse and also of the rectum and a few other related areas, both medically and surgically.
Okay, so these are the true, quote-unquote, as my daughter says, these are the pee-pee doctors, and they know just about, and so they're already surgeons, and they're already gynecologists. They've done all that training, and then they have special training beyond that.
That's right.
How big of a problem is, or how prevalent of a problem are these problems of the urinary tract? We'll call it the lower urinary tract here for this discussion. And, you know, problems of the bladder and the related organs, the vaginal area, the rectal area, as it relates to urine problems.
It's very common for women, really of all ages, to have some issues from time to time. Urinary tract infection, as I'm sure you're aware, is the most common reason why people visit an urgent care setting in the entire United States.
Remind you to check out My Menopause Magazine in the Apple newsstand, and also if you like that song Incontinence and you'd like to hear other songs about women's health, you can check out drseibel.com/store, and you can find CDs that have all kinds of music about health that are going to be fun and interesting to listen to and educational. So remember, everyone, it's better to stay well than to get well. So stay well, everyone.